everyone! Congratulations on making it to the end of the semester. Today I'll be presenting on a journal article that was published in 2020, and the article is called Early Aerobic Exercise for the Treatment of Acute Pediatric Concussions. The article is about 9 pages long and includes information about aerobic exercise as treatment. Concussions are becoming an increasingly prevalent injury for youth worldwide. According to the study, approximately 1.1 to 1.9 million sport and recreation-based concussions occur in the United States in youth 18 years and younger per year. The study shares about how pediatric patients who experience concussions are presented with a variety of physical, cognitive, affective, and behavioral signs and symptoms, and these can include headaches, nausea or vomiting, loss of consciousness, fatigue, confusion, difficulty focusing and remembering. Thankfully, most of the pediatric patients who experience concussions have a relief of symptoms within the first few weeks after their injury, with only a small percentage of patients experiencing some delays in recovery. So early treatment paradigms had a consensus for concussion management, and that was to place patients on a strict physical and cognitive rest until the resolution of their symptoms occurred. However, more recent recommendations now advocate for a more active approach to concussion care. Most of the literature available on concussion care relating to aerobic exercise is seen in patients with protracted recovery, and that means patients who have prolonged recovery. Because patients with concussions cannot regulate cerebral blood flow, some symptom aerobic exercise can help correct that impaired localized blood flow. So a lot of the literature supports the fact and idea that aerobic exercise can greatly improve brain health by promoting brain vascularization and also increasing levels of brain-derived neurotrophic factors, which will help promote the growth of new neurons, as well as help repair and protect neurons from degeneration or other adverse conditions. So similar to how aerobic exercise benefits patients with protracted or prolonged recovery, the researchers of this study were interested in exploring if aerobic exercise could be implemented as a rehabilitation strategy in the more acute or early stages of recovery. So the main question for the study was, can aerobic exercise optimize the recovery period or perhaps lessen the risk of developing persistent post-concussion symptoms in pediatric populations? The study design took a bibliographic research strategy to reduce biases, and its search yielded 1,623 potential articles for analysis relating to acute concussion, sports-related concussion, and the benefits of aerobic exercise. So those were some of the key terms that were used in the search field, and it yielded 1,623 potential articles from a plethora of different resources like PubMed, Google Scholar. And in order to eliminate and reduce some of the biases and to look for quality results, the researchers applied a series of inclusion and exclusion criteria to evaluate whether or not the study would be relevant. And at the end of this process, they were left with 5 relevant studies. So this research and these findings are based off of these 5 relevant studies. So some of the inclusion criteria includes the patients or the research articles that they cross-referenced needed to have patients with acute concussion or sports-related concussions. The patients needed to be between the ages of 5 to 20 years of age, so that it could still count as pediatric 3 youth. Also, the studies needed to incorporate some form of an aerobic exercise program implemented within 10 days of the concussion. For exclusion criteria, they had anyone who had prolonged concussions for more than 4 weeks or persistent post-concussion symptoms were automatically ruled out, so studies including that population were not included. Studies published in a language other than English were also excluded, and studies published before 2015 because they wanted the most up-to-date and relevant information. The researchers then went ahead with the 5 remaining studies and looked at the feasibility and safety of early exercise interventions. They looked at symptom resolution and recovery time, and also looked at the exercise prescription that was given in each of these studies. And the results were very interesting. When appropriately prescribed during the acute stages of recovery, the researchers found that aerobic exercise was actually very well tolerated by our pediatric patients. They also discovered that introducing aerobic exercise early on does not increase risk of protracted recovery in the pediatric population. And they also found some research and evidence that moderately supports the idea that early subsymptom aerobic exercise can lessen the symptom burden and expedite symptom resolution. The study had many limitations, however. Although there was good quality evidence and the study was well structured, it was from a small batch of research articles with only 5. In addition, there were no physiological measures of autonomic nervous system function or cerebral blood flow taken by any of the researchers from the 5 different articles that were cross-examined. And lastly, the consistency of the exercise factors, how frequently the participants were required to exercise, the intensity of their exercise, the duration of their exercise, or even the type or the optimal time frame of when the exercise interventions were delivered, were also not included. Well, I do wish there was more relevant studies pertaining to this subject, especially since concussion injuries are becoming more and more prevalent. I do think that there's a lot of relevance of this study to the field of occupational therapy. Whether we're in pediatric care or adult care, concussions and head trauma can greatly disrupt one's ability to engage in meaningful occupations. It impacts our lives socially, our ability to do ADLs, IADLs. It impacts our ability to be productive, go to work. So having an understanding of the different types of treatments available beyond just the preliminary findings, that said, not from this study, but from previous studies, that basically dictated that, bed rest is the best way to go, staying off of screens, reducing your exposure to certain sensory stimuli. And now there's this new study, kind of looking at how early aerobic exercise can actually be used as a treatment modality and transform how we provide care for acute concussions in pediatric populations. So there's a lot that's connected to occupational therapy, and I think having a better understanding of aerobic exercise as a treatment modality will greatly help us to get our patients back into a place where they can engage meaningfully in their occupations.